Thanks for everyone being here today and listening to Dr. Leech talk about the update from her division research grants that she received last year. Dr. Leech is currently an assistant professor at USC, has been here 4.5 years, and has beautiful new glasses on today. And we look forward to your presentation. Please, Kristan.
Thank you very much. Okay, so it's not advancing. Okay, so for those of you who don't know me, I run the Gait Rehabilitation and Motor Learning Lab here in the division. And the main mission of the lab is to advance the scientific understanding of the human nervous system and develop scientifically based interventions to improve the health and quality of life of individuals with neurologic injury and disease. The majority of our work right now is really focused on people living with stroke. And we have been fortunate over the last few years to have multiple funded projects running at the same time, all attempting to recruit people living with chronic stroke. One of the really valuable resources within the division to do this that has enabled my ability or the feasibility of running these projects all at the same time is the RARE database, or the Registry for Aging and Rehabilitation Evaluation. That was started, if you're not familiar, this was started by Carolee Winstein in 2011 and currently has about 600 people in it with a range of both upper and lower extremity motor impairments. And one really impressive thing is that this database for recruiting willing research participants is that it's IRB approved both at USC and through county, specifically at Ranchos Los Amigos. It is currently administered by Amelia Kane, who should be pretty familiar to many of you. She's currently a PhD student in my lab and was a neuro resident here in 2020. And I am in the process of switching, transitioning into the PI position for the IRBs that run the RARE database, taking it over from Carolee. One thing that's really impressive about the RARE database is that it's not only supported the research performed by me and Carolee, but it also supports the research that's ongoing through 6 different labs at USC doing stroke research, all of whom are featured on this slide. Hopefully they don't mind I use their pictures. One thing that we noticed though with RARE through the pandemic is that before the pandemic, we were recruiting about 10 people on average every 6 months into the RARE database, new participants who were interested in participating in research at USC. And then when the pandemic hit, obviously our recruitment into RARE dropped to nothing in the fall of 2020 and has really struggled to recover recruitment since then. So as an effect of that, I started to have a hard time recruiting people into the projects that we had ongoing in the lab. So I applied for the division research grants to support recruitment into the ongoing studies that we had. I'll talk a little bit about some of the strategies that we used to do this, but I want to highlight that as a result of a lot of the work from master's students and my PhD students, we have really significantly improved the recruitment into the RARE database. So this is not only helping the recruitment for the studies that we have ongoing in the lab, but it's also hopefully supporting the broader stroke research environment here at USC. So the recruitment campaign that we launched was multifaceted. We used the CTSI I2B2 resource, which pulls the contact information for people who have been within the CEC system with a specific ICD-10 code and lets us have access to their phone numbers, email addresses if they have them, and then their physical mailing addresses. So we launched a call, email, and mailing flyer campaign. This was really pushed forward by 2 master's students, Juliet Keebler and now Tyler Goldstein. We also started using an NIH-funded platform called Research Match, which is essentially like for lack of a better term, a dating app for research studies and potential participants, where participants can kind of enter their clinical profile, and then they get presented with the opportunity to share their contact information with ongoing research studies. We launched social media ads. My PhD students have been going and presenting to local support groups. Primarily, this has been done by Kristina Hall, who is also a PT. Amelia Kane has started attending the neurology stroke clinic every week on Wednesdays. We've peppered flyers all over the city with QR codes where participants can just scan the QR code and send us their contact information and express their interest in our work. And then more recently, last weekend, Kristina Hall attended LaserNet, which is an organization for stroke research in the LA area, run by Steve Kramer at the California Rehabilitation Institute. They held a stroke awareness picnic last weekend, and Kristina went and saw some of our participants there. And then in a few weeks, we are also going to attend the Stroke Fair, which is run by Rancho Los Amigos. Shout out to Jojo Robinson for connecting me with the right people at Rancho to get that done. So now what I'm going to do is ask for your help. If you have any patients or know anyone in the community that might be interested in being added to the RARE database, please share with them the email address that we've set up for RARE. And then I'm going to drop our participant interest forms in the chat as well, so you can distribute them as you see fit. And then I will just make a plea that if you are one of the labs that I highlighted, or you're someone else doing research or engaging with people with stroke in this in the community, please share with them this opportunity to be added to a database where they can be contacted by multiple labs and get involved in research in multiple ways. Thank you.